Welcome to Benita's maternity program antenatal class. Today, Sister Talia will be chatting to us about the first year survival kit. Welcome, Sister Talia.
Hi, moms. And yes, the first year survival kit is a list after my three kids, my 2-year-old, 7-year-old, and 10-year-old. Over the years, I've compiled, and also being in the trade and industry of midwifery, as well as babies and toddlers in the neonatal units, as well as the pediatric units, I've come to realize this is the ultimate in survival. So an infant survival kit is essential for the first year. Unfortunately, we do not realize it until it's too late that we actually need to have this pre-packed already. Simply put, it's a basic first aid kit, but it does not contain the things that you would have in your car or household first aid kit. It does contain vital tools needed in an emergency with your toddler and your infant. So what does it contain? It has your nasal aspirator or bulb, even like a nose feeder, baby thermometer, medicine dropper, baby nail clipper or nail file, scissors, your baby brush or comb, your sterile gauze. It has your saline nasal drops, which is very important, your ibuprofen-like syrups like your Nurofen, your Ibumil, and then your paracetamol-like syrups like your Panado, Calpol, or Empapet suppositories. Saline drops for every eye spill or infection. So it has your Allergac syrup, your Talfar syrup, your Allergac cream, Doctarin gel, and Nastacid. So this is all for oral thrush. Your Rooibos tea, it can be any brand, we're not brand specific. Antiseptic wipes such as Dettol or Savlon. Antibiotic ointment for cuts and grazes. Your Band-Aids, and then your burn shield. Small ones is preferable for kids, and your gripe water, Colic's drop, or even your Progress infant drops. Humidifier, a Carvel or Puma bomb, so anything that's mentholated, Prospan cough syrup, Laxon or Laxate syrup for constipation, your petroleum jelly, and then last but not least, your humble Mazina. So what do we have first? We have a contact card. So it's a little card that you make and you compile all the numbers of the most important caregivers, pediatricians, or the GP in the baby or toddler's life so that it's immediately accessible to whoever is with the toddler at the time of the emergency. Then we have a grooming kit. It may seem very unlike an emergency, but if we don't groom babies' nails with our little nail file or nail knipper, it can scratch their face. And if we don't do their hair, brushing and combing, it actually can cause cradle cap. So yes, the all-important flu buster kit. So this is a very important thing. Most babies will have in their first 2 years a cold and flu, a nasal blockage. And it's very common even when your baby is a newborn, comes home, and it makes drinking very difficult. And babies are necessity. Their necessity is drinking and their milk for the first 2 years of life. So what do we need? We need a nasal saline spray. So what the saline does, it's nice and gentle. You use it, it moisturizes the nasal passages and it lets baby drink with ease, their bottle or their breast. And then I've used the nose feeder nasal aspirator. And you can even use a nasal bulb you get. You can actually trial and error helps with any mom, but that was quite user-friendly for me because babies cannot blow their own nose. They're unable to do it, and all that mucus and gunk sits in here, and we can think when we have a cold, it actually causes quite a big headache to them. It makes them uncomfortable in this general area. And then we have our rubs. So baby is a bit chesty. You can take some Puma or some Carvel rub and you mix it with a little bit of Vaseline. The reason for that is baby skins are quite sensitive. And like us, baby skin varies. So it just eases a bit using the usage of the product. And then cough syrup. Prospan is great because it's from birth. So immediately you can use it when your baby is a bit chesty. And it really does soothe them for the night, and especially because these things, the most emergencies happen at night. And then next we have our humidifier. So it's really nice. It gives some moisture in the air. It relieves that dryness that's associated with the flu that we have in our nasal passages and throat, and it allows baby to drink much better. So the next thing is fever. So I should have called it fever buster kit. But how we manage, we can only manage fever. So we can't stop it completely when it's happening, because it's obviously, we have a previous video as well. You can go and look at managing fever in completion. But in an emergency, we want a temperature to remain below 37.6 degrees. So thermometer, I always stress this, is very important when you're buying your baby products and you're a new mom or you have kids at home. Always check that your thermometer is working. So medications such as paracetamol, like your Empapet suppositories, those, and as well as your ibuprofen medication, it must be given alternatively. So they can't be given together, but they should be given according to the weight of baby and not the age, because each baby can have a different weight for the age. So you get a certain kilogram 1 year old and a different kilogram 1 year old. So you must go according to the weight and not the age of baby. And you need to alternate it. You can't give it every time Panado, or every time a paracetamol-based one. Like your Panado and Calpol, you have to alternate it with your ibuprofen-based ones, like your Nurofen or Ibumil. So that is very important. We need to always, first of all, give something for pain and for fever. We can't just leave it, and we need to manage it in such a way. So burns happens very easily with toddlers and kids around. They move around, they're so fast, they are faster than our eyes sometimes. So always have a burn shield. It really does relieve the pain immediately, and it gives baby that sense of comfort when we know a burn is quite painful, and we can't always give them the comfort immediately, but the burn shield does give that. And it's something to have just in mind. You get different kits, so just the basic one, a packet of burn shield, and it has like little strips in it, looks like gauze, and those are the ones you will be using, and you can reseal it after using one or two, and by that time you would have gotten maybe to the emergency room or to your GP or pediatrician, and then they will advise you further on managing the wound. So teething, it's part of the emergency. It happens the first year of life. It's almost what all your niggles are, your niggles and frills of babies are about. It's about teething. So what do we do? As early as 5 months, they can start teething. So we relieve the pain. So T-Gel, Pure Beginnings is another brand. This is very good things, as well as your teething ring. Please have it in the survival kit, because without you knowing, you will start to see the signs of baby chewing their hands, playing around, drooling a lot. Then you know this baby is starting to teeth, and I cannot take out this from my kit. Nappy rash. So this is very common. It's due to the external elements, for instance, a reaction to the particular nappy brand, and it can even be due to a certain skin type that is quite sensitive. So what do? We do rooibos tea. Any brand, like I told you previously, can do. You take about 2 tea bags, you place it in the bath of baby, and you let the bottom of the bum soak in gently. It relieves the burning. It really does soothe the skin. If you do not want to now, run a big bath or submerge baby in the bath, you can even dip the wet wipes in this little, you can take a little basin and put in your 2 tea bags, let it pull through and get nice and dark. And if you use your wet wipes and you dip it in there and you use one at a time and discard, never reuse, because we don't want to spread infection. It really, really is amazing for babies that has nappy rash. And next we use a oldie but a goodie. It was the last one on our list, and that is, you put first a layer of petroleum jelly. So we are basically manipulating the skin and thinking we are adding layers to the skin. So that is what is going to help the healing of nappy rash, especially if it's broken down the skin already. And then you place the layer of Mazina. So Mazina, it's a great base if you're using this. But if you put it in a Ziploc bag, it helps a lot, and you just sprinkle a little at a time, like you would dust a cake on top or put something on a icing, for instance. So you just put some on top of that petroleum jelly on the bum, and you put on the nappy, and it really, really gives a nice coating, and it helps and relieves the nappy rash. Next, we have skin rash, allergy or insect bite. It is summer months now. And in summer in South Africa, we have all the time these ailments with toddlers, babies, and even older kids. So what do? Again, we use our trusted rooibos tea. So we put it in the bath. We let the bath nice and get nice and dark. So we put about 2 tea bags, does the trick. You put in your warm water, and that really brings out the flavorings of the tea bag so that it can get, or strengthens it at least. And then you apply you can put in a nice face cloth, and you can rinse the body with it, or you can submerge baby or toddler into the bath. Afterwards, you pat the rash doesn't want to be tugged or pulled or even wiped hard, just a pat dry. You apply a thin layer of Allergex cream to the rash for the itch. Please avoid the eye area, avoid the mouth area, because there is active ingredients in there that is not good for those areas and that can penetrate the skin by the eyes or by the mouth, the membranes. And what we also don't want to do is don't use these things on babies that's younger than 6 weeks. So you can do the rooibos part, but then afterwards, just use your normal cream, white cream, we always say, like your Epimax or your aqueous-based creams, but don't then go the Allergex cream route, or even in terms of the Talfas or Allergex syrup route. We don't want to be using that on a baby that's still too young. Next is nausea and vomiting. Again, it's summer season. As the temperatures go up, food spoils sooner. So what happens? It causes in babies and toddlers that vomiting. So what we do is we get Valoid suppositories. These are things that you can keep in your fridge. So not at the back where it can get frozen, but on the side at the door of the fridge. It's very good to have. What it does, it actually can stay longer. It doesn't expire as quickly. And you can use it on your baby and your toddler if they are unable to swallow. If they are vomiting, it's very hard to get a syrup or anything in that will stay in. So this is quite a nice way to relieve of that dehydration that may occur later on. So now we have our colic and winding problems. This is the most common problems in babies and toddlers, and it's also it's quite difficult for a mom because she doesn't always know what to do. So it is definitely part of the survival to know what to do. So you get your colics drops, you also get your Progress infant drops, and that really helps to digest the milk. It helps with the cramping and as well as the winds, to let the winds ease out of baby on top or at the bottom. So remember, wind doesn't always come only on the top out of little babies. It sometimes comes out the bottom as well. So that's also considered a way of them relieving that colic or trapped gas. And hypospasmal syrup for cramps. This really helps. Again, not for babies under 2 months with the hypospasmal syrup. The doctor will advise you if your baby is younger, but it's so severe and the cramping, he will advise you what to use. Diarrhea is very common, and what we don't want is a dehydrated infant or child. So what do we want to use? We want to make sure we rehydrate. We make sure that we get enough fluid in. But how can you get fluid in if everything is going out? It's quite a difficult balance if you're managing a baby or your toddler that has diarrhea. So you make sure you try and stop it with something called smecta. You can use some, and that's just to help the dehydration by adding electrolytes. It's quite good. It forms stool a bit, and you give it after each bout. So each product, for instance, Smecta, will have the dosage and instruction again by weight of baby and how to give it and how often to give it. And then we have the next part, constipation. And yes, it is a survival, part of the survival kit, because to be honest, a lot of babas suffer with this, and it is something that's quite uncomfortable. It makes them paining, their stomachs are not well. So what do? We can use Laxette or Laxon syrup. It can be given to babies and toddlers as a relief in an emergency. So it's not supposed to be used daily, because we would like their bowel and their peristaltic movement to happen by themselves and naturally. But if we are always giving them something, it's going to make that process lazy. So, but in an emergency, so for the first few days of severe constipation, it's great using these two, Laxate or Laxon syrup. Again, dosage as per instructions on the manufacturer's bottle. Next, bumps and bruises. It happens. They start to cruise when they're halfway crawling, halfway walking, and then you left with this bump and bruise that looks humongous, or it's bleeding so severely, and you don't actually know what to do, and you don't have anything. First of all, we want to make sure our hands are clean, and we want to clean the area with the antiseptic. I love the washes such as Dettol or Savlon. You mix it in your water and make sure it's clean water, and then you apply your antibacterial ointment and your gauze. If your baby bumps and it's a bleed, and it's a little bit of bleed, you can, or a big bleed, you can keep pressure on it with your clean gauze, and afterwards only clean it. Wait for it to form a little crust, and then you clean it. Otherwise, it may bleed too much. If it is a bleeding that you are keeping for more than 30 seconds and it's still gushing, then that's an emergency room immediately. You keep pressure and you get in the car and you go to the hospital. And in terms of the ointments you use, antibacterial ointments, there's so many different types. You can use the one that is most comfortable for you and for Baba as well, because some of them can sting baby's skin a bit and makes it uncomfortable for them. And a nice Band-Aid, that's my go-to in my cupboard with all my kids. A Band-Aid that has a teddy bear on, a little clown on, anything, and the kids then get to pick which one would you like, and you just see that smile on their face with this big bump. They just feel better already. And then you get your eye spill and infection. This is very serious because we don't want permanent damage to any baby or toddler's eyes. So first, Mom, you take your saline. So you have a little saline. They normally give it in a little ampule that you can keep in your emergency kit. You open it up and you rinse. You don't rub with your hands, your fingers, nothing. Why don't we rub? Because if it's a chemical thing, we're actually going to rub it into the eye, because this is open membranes in your eye. So we're just going to rinse and get to the hospital. And you can actually take, if it's something that you can see, for instance, sand, you can actually take, after you rinsed it, you can take your gauze and clean from the inside out and discard. Never use it again on the other eye. From the inside out and discard. And that just helps relieve anything, and it can prevent more damage than what could have occurred. So a disclaimer, I myself, Talia, as a midwife and a pediatric sister, I've curated these products myself. Bonitas and PediaQ have not endorsed these products. And please seek medical advice if uncertain or before taking any of these medication. Always be advised that all medications should be given to babies and toddlers with care, following the dosage on instruction leaflet according to the weight of the child. This is simply a guideline, moms, in an emergency situation and does not constitute a medical diagnosis or a treatment. I hope I've really opened up a bit more about first aid as well as survival kit for different things that can happen. I know that whenever our babies are in discomfort, that is an emergency to us as parents, and we do not always know that moment what to do. So please keep this video nearby and reflect on it again if you're uncertain about certain things, and feel free to just give us a comment at the bottom of the page and just let us know if you want to have any more info. You're more than welcome to. Have a great day.